Now for the exercise program. So with the exercise program, some exercises are going to be more difficult than others, just depending on where your pain is. It's really important to start at a comfortable position again, so feet apart, shoulder width apart, and we can start. So the first exercise for you is taking your arms out to the side and just do some gentle circles. So as you can see with Lauren, she's doing some gentle circles forward, and then she's going to do that to a manageable amount, say 5 or 10, whatever works for Lauren, and then she's going to do the same amount going backwards. So it's really important that you be conservative, because if you're going forward a number of circles, then you've got to do the same number going back. So don't push or force yourself. The second exercise in the exercise program is the side lean. So that involves Lauren leaning against the wall or a fence, having the arm across, just resting on her stomach, and then moving her hip towards the wall. So as she's doing now. So it doesn't have to touch it, it's just moving towards and then back out again, making sure the feet are away from the wall, the clear distance, so there's room for her to move in and out. And she will just record how many times she did that. Obviously just a manageable amount to start with, because we're just setting the starting points at the moment, and then turn around and do the other side. Good. So if Lauren did 3 on one side and 5 on the other, we'll record 3 as her starting point. We always take the lower number to be conservative. For the next exercise, it's what we call a sit to stand exercise. This is obviously for your buttock muscles and your thigh muscles to get them stronger. So the exercise is basically you've got to stand up from a sitting position. So you need to find a chair or a seat that's quite firm at a level height. So not too low but not too high either. So Lauren's sitting in a standard chair. So I'll get Lauren to stand up and sit down. So what you would do is just do this, stand up and sit down as many times as you can manage. And remember, it is how much you can manage, so don't force or push yourself. Just a comfortable number that you feel is a good start point. Now the things to look out for is that when you're standing up, is not to let your knees move in. So if you can watch Lauren, when she's sitting back down as well, just make sure the knees don't go in. Stand up, Lauren, and with the knees going, yep, and then back down again. That shows that you're using other muscles apart from just your buttock and your thigh muscles. So making sure your knees are apart, and then when you stand up, your knees remain apart, and when you sit down, your knees remain apart again. So one more time, and up and down. And you just record that number in your exercise sheet. So the next exercise, moving from the sit to stand, is your chin in. So it's similar to that stretch you did. So what you're going to do is you're going to poke your chin out and then take your chin right back. So making sure that you're not looking down or up, just straight out and then straight back. Just imagine your chin is on a table or a flat surface, and you're going to move it forward and then straight back again. Okay, and you do that for, again, a manageable amount, and don't push or force yourself. Good. Now we're going to move on to some floor exercises. So the first one of the floor exercises is what we call the tummy tucks, and it's really looking at strengthening your core muscles. So these are the muscles just below your belly button. So what I get you to do is just tuck underneath your belly button. You got to hold that there while you breathe in and out 3 times. And then once you finish breathing in and out 3 times, you just relax. Okay, and then tuck in again, you hold, and while you're holding it, you breathe in and out 3 times, and then you relax. The reason why I get you to do that is because sometimes we trick ourselves by using our stomach muscles to breathe as well as your shoulder muscles. So by doing this, I'm getting you to isolate your core muscles to strengthen your core while you're breathing using your muscles that you normally use to breathe. And you just do that to a manageable amount, and once you've done that, you just record that on your exercise sheet. So just one more time, what you're doing is you're tucking in just below your belly button, you hold that while you breathe in and out 3 times, and then you relax. And that's a 1 count. The next exercise is what we call back arches. So it's lying on your tummy, like so. So your hands are close to your face, and basically you're using your palms to push up and arch your back. So you can come all the way up like Lauren's doing because she's flexible, or if you can't, you just go back down and just come up to whatever you can manage, like so. And that's fine. It's just important you start somewhere and do what's manageable. So, and you come up again and do the level that you can do, and just record that number in your exercise sheet. Okay, this time what we're doing is lying flat on our back, having your hands on your thighs, and we're going into a sit-up position. When you're going into a sit-up position, a lot of people make the mistake of using their neck and bending their neck forward so that they can see their legs. You shouldn't be able to see your legs. The key is that you pick a point in the ceiling or the sky, and you got to go towards that. So your eyes should always be focused on that, so that your neck and head are straight and there's no strain. So when you're going up into the sit-up, your arms go up, hold, and then back down again. So arms go up your thighs, up to the knees, hold, then back down again. So nice and relaxed, okay? And do a manageable amount. It doesn't matter whether you do 2 or 20, just go to your manageable amount as a start, and then you build up slowly. Excellent. The next exercise is lying on your side. It's what we call the scissor leg. So you got your bottom leg bent in a triangle, your head nicely supported by your hand. You're making sure your back, the top leg is straight line with your body, and then you're lifting the top leg up. The heel comes up first and then back down again. So just bring it up as far as you can manage. You'll feel it in your buttock and the side of your hip, and then lower. Okay, and you just count how many you can do, and then once you've done one side, you swap around and do the other side. Bottom leg bent in a triangle, top leg straight, in line with your body, and then you're up and you're down. And remember, the heel goes up first, not your toes. And what you do is you just find out whether the right or the left side had the lesser amount, and you take the lesser amount as a start. Remember, we're trying to be conservative. You can always build it up faster later on, but if you build up too fast now and you get a lot of pain, then you have to come back again, and we don't want to do that. We want to make slow, gradual build up of your exercises. The last exercise in lying is lying on your back. These are called tuck-ins, and basically it's bringing your legs up towards your chest and then back out again, like so. Again, do what's manageable for you, back out. If you're finding this difficult, then just lift up to about there and then back down again. You don't have to lift all the way to your chest. If you're finding this really, really easy, the way you make it hard is you bring your legs up towards your chest, and then as you take it out, you straighten your legs out a little bit more, and then back down again. And then up, and then straighten your legs out a little bit more as you go back down again. The key to doing this exercise right is to making sure that your lower back is flat against the mat or the floor that you're doing it on. Don't let it arch up. So if you want to check yourself, you put your hand underneath, so it's in your lower back, and you press your lower back against your hand or into your hand, and while you're doing it, you bring your legs up and down while you hold it down or press into your hand. Good. And that's all the floor exercises, and we'll move on to the next one. So the next exercise is doing steps. This is just to get your body used to the normal movement of doing stairs and steps, which you may not be doing. Just going up one step at a time, alternating your feet, and then coming down again. So we've now got here 4 steps that she's gone up and down, so that's 4. And then if she goes back up again, that's 5, 6, 7, 8. Remember, if you go up the steps, you got to come down. So make sure you use a manageable amount. If you don't have stairs at home or can't get access to stairs, but you have a step, then you can just go up one step and then back down again. Yep, exactly like that. And just make sure you do it with both feet leading up and down, and that's also fine. Now, you might be used to just doing one step like this and then turning around and doing sort of the same. We don't want you doing that now. We want you to get into the normal rhythm of doing steps like Lauren's doing, purely because the other way, you're strengthening one side more than the other, so there's a muscle imbalance. So doing it this way is more natural and more normal. So the next exercise is jogging, and it's just a nice, slow, relaxed jog. So I don't need you to run hard or run fast. As you can see with Lauren, she's just doing a nice comfortable pace, and she's doing short distances because that's as a start point. So what I get you to do is either record the amount of time you jogged for or the distance that you jogged. And you could just say it's 1 block or 1.5 blocks, it doesn't matter. As long as it's just a comfortable amount and that it's a start and you're happy with that sort of amount that you're doing. If you can't jog for whatever reason, then we can perhaps start jogging on the spot as a starting point, and that's okay too. Just record how long you do it for in the exercise sheet, and then we can build it up over the weeks. So the last exercise in the stretch program is what we call the shoulder press. You need a light weight in your hand for this exercise. So you can, if you don't have light weights, then you can certainly use a tin of jam or a milk carton filled with water. Just make sure it's a comfortable weight for you. So basically what we're doing is we're raising our elbows up to the level of the shoulder, and then we're taking both arms up over your head. Don't lock your elbows, just nice and relaxed, up, down sort of motion, which is what we want you to do. And you just record the number that you do and then write that down in your exercise sheet. Now, if you want to do it slightly differently, you can also go alternative arms, so like so. If that's going to be more comfortable for you, no issue at all, you can do it like that. The important thing is you do it just in a nice relaxed way, and you're handling a weight that's comfortable, and you don't force yourself, you just be conservative, and you're just finding what's a manageable amount for you. So that's now the full exercise program. You've now got the starting points for each of your exercises. There's also room to do a couple of your own exercises if you find any that's useful and set the starting points. But if you have a look at your exercise sheet, you've got the numbers for the first week of exercise. You just got to pick your 3 days that you want to do them in the week and just do them, and as you do them, tick them off. And if you read your book Beyond Pain, it'll teach you how to progress your exercises into the next level, into the weeks ahead. Thank you and good luck.